Now we will discuss acquired cataract. Okay, so when the opacification of the lens develop during later in life, this is called acquired cataract. Okay, now it has been acquired in the later life. The opacity has been developed in the lens during the later life. Okay, so etiology. There are also multiple etiologies like in congenital cataract. There are also multiple etiologies of acquired cataract. The most common is the aging. Okay, they are saying that by the age of 70, about 90% individual has acquired cataract. Okay, so aging is the most common etiological factor, and this is it is the aging cataract is called senile cataract. Okay, it is followed by trauma. We know that in the young individual there is a high chance of trauma. Okay, so penetrating injuries and contusion injuries can cause the cataract. Okay, and the contusion injuries is the blow injuries, the contusion injuries on the eye, it can cause a type of cataract which is called rosette cataract. Okay, contusion injuries can cause rosette cataract in young individual. This is also common. Traumatic cataract is also common, very common in young individual. Rosette cataract is like in the rose shape. Okay, it will like in the rose shape like this. I'm sorry guys, I cannot write, but it is like in the rose shape. Okay, rosette cataract. Then we got the ocular diseases. For example, in the corneal ulcer, there will be the chance of uveitis, and due to the interior uveitis, there can be the ulcer. Okay, so when the iris is inflamed, this inflamed ulcer will also will damage the underlying lens and will cause cataract, which is called complicated or secondary cataract. Okay, metabolic diseases. For example, as we have previously discussed, hypoglycemia, hypocalcemia, diabetes, galactosemia, they can also cause acquired cataract. Okay, systemic disorders like the Wilson disease, and in the Wilson disease there is a cataract, a special type of cataract which is the sunflower cataract. Okay, so we will get a sunflower cataract like this. Okay, we will get sunflower cataract and Wilson disease. Like another systemic disease, imperfecta osteogenesis, okay, myotonic dystrophy, atopic dermatitis. These all systemic disorders, osteogenesis, imperfecta, myotonic dystrophy, and atopic dermatitis, we can have acquired cataract. Okay, and syndromes. I have made a mnemonic for syndromes which is Dilmer, DLMRW. These syndromes are also associated with the can cause the acquired cataract. Dilmer, for example, the Down syndrome, the Lewis syndrome. Lewis syndrome is oculocerebrorenal disorder. Okay. Then we have the Miller syndrome. In Miller syndrome, we have the post-axial acrofacial dystocia. Okay, dystosis. We have the Rothman syndrome. In Rothman syndrome, we have this the skeletal, muscular, and eye abnormalities. Okay, and the last one is the Werner syndrome. In Werner syndrome, this is the premature aging. Okay, it can also have acquired cataract. So remember this syndrome by the Dilmer. This syndrome can also causes the acquired cataract. So these are the multiple pathologies: the age, the trauma, the ocular diseases, the systemic diseases, drugs. Okay, drugs like corticosteroids and miotics, and these syndromes. These can causes acquired cataract. But as I told you that the most common cause is the aging senile cataract. So we will only discuss this type of cataract in details. Now, senile cataract is by the age of 70, 90% individual has acquired a cataract which is called senile cataract. Now, on the basis of this location, this senile cataract can be of three types. It can be posterior subcapsular, cortical, and nuclear cataract. Okay, so posterior subcapsular cataract. Posterior subcapsular cataract, it involves mostly this posterior subcapsular area. Okay, it is involving this posterior subcapsular subcapsular area, posterior subcapsular area. And remember, it is commonly encountered in young individuals and it can cause severe visual deterioration. Why? Because as it looks like a small insignificant opacity, but you know this is the nodal point. The nodal point where most of the rays, when the rays come, most of the light rays, they are focused by this nodal point on the retina. So, due to this nodal point involvement, this type of cataract is causing severe visual deterioration, particularly during a day. Why? Because during a day, due to the brightness, there is the pupillary construction, and so the pupillary construction, the brightness will be, the pupil will construct, okay? Due to brightness, the pupil will construct, and now the light is diminished more. Now the nodal point has more advantage and will further stop the incoming rays of light. That's why the posterior capsular cataract, although it is only accounts for 5% cases of the senile cataract, okay? Only 5% cases, it is rare, but it can be a visual deteriorating condition, okay? Now we have the cortical cataract, and this is important, okay? It is about 70% of all the senile cataract, 70% is due to the cortical cataract, okay? 70% is cortical. Cortical cataract, it is when it involves the cortex, okay, it is called cortical cataract. So what is the pathogenesis? The pathogenesis of cortical cataract is important. It involves mainly 5 stages, okay? The first one is the lamellar stage. What is happening? First of all, remember, due to age, what is happening? Due to different stresses, this permeability, the permeability of this capsule will alter. When the permeability of the capsule alter, so the water and other fluid will start rushing into the lens. Because of the changing permeability, now there will be the hydration of the lens, extensive hydration. What will happen? Due to this increased permeability, in the lamellar stage, there will be the lamellar stage first, okay? In the lamellar stage, what will happen? The fluid will collect. The fluid will collect between these lamellae, okay? The fluid will collect between these lamellae, and it will cause demarcation of these different lamellae, okay? Now the fluid has caused lamellar separation, okay? So the layer has been separated because of the accumulation of extensive fluid between these layers. So what will happen? Because of this property, now the light rays which will come, they will extensively scattered and reflect, okay? Because there is now no regular arrangement, so what will happen? Some of the light will extensively refract, okay? And some of the light will extensively reflect. So due to the extensive reflection and scattering of light, the patient in the lamellar stage will perceive extensive brightness in the visual axis. Whenever he tries to look to something, so the light, there will be extreme brightness in the visual axis. This is called glare, okay? And glare is occurring due to this lamellar separation by the fluids, okay? So the fluids separation basically cause the extensive reflection and scattering of light, and will cause brightness in the visual axis. Now it will be followed by incipient stage. What is incipient stage? As now the fluid has collected, okay? The fluid has collected between these layers, so it will cause stress, pressure on these lens fibers. What will happen? Ultimately the proteins in these lens fibers will degenerate and will denature and will clump together and will cause opacity. in the incipient stage, these opacities are like spoke-like opacities, in which the pointed end is oriented toward the nucleus. As for example, I have removed the cornea. Okay, this is the iris, and this is the lens nucleus. Okay, this is the pupil through which we are seeing through the lens nucleus. Okay, this is the lens nucleus. Now, in the incipient stage, due to the pressure of this fluid, there will be the opacities. The opacities like in this manner. Okay, spokes like opacities. Spoke like opacities will be present, in which the pointed end is oriented toward the nucleus. Okay, so what will happen in the patient in this incipient stage? The patient will present to us with double vision, even multiple vision, polyopia, diplopia, polyopia, and halos. What are halos? Halos are when we look to something, there will be a rainbow like structure surrounding it. Okay, so the image, the bulb, everything, when we look through it, it will surrounded by a rainbow like structure. This is called halos. So why these halos, double vision and multiple visions are occurring in incipient stage? This is because as these spoke-like opacities has been formed, and these spoke-like opacities has now changed the refractive indexes. Okay, now we have multiple refractive indexes, so there will be the generation of multiple images. Okay, on the retina, some light will be focused extensively over here, some will be focused extensively over here, some will be focused extensively over here. So we will have multiple and double visions. Okay, because of the changing refractive indexes due to these spokes like cortical opacities. Now it will be followed by immature cataract stage. In immature cataract stage, what will happen? These opacities will coalesce together. These cortical opacities, spokes like opacities will coalesce together and will further deepen. Okay, they will further deepen. They will further deepen and they will coalesce together. And now we will have opacity, deep opacities and extensive opacities. Okay, and there is a problem, there is one problem which is called hypermetropic shift. What is hypermetropic shift? First of all, look through this normal phenomena. Okay, so what will happen? I'm sorry guys. So whenever a light rays come, okay, this is the lens. Okay, this is the lens. Normally when a light ray or rays, when they come, this is the nucleus. Okay, it is important to draw it. So when the light ray, when it come, it will, as we know that due to the different refractive index, the light will be refracted. Okay, it will change the angle. Now it has refracted. Okay, when it goes through the nucleus, as we know that the nucleus has more refractive index than this cortex, so the light rays will be further refracted. Okay, now it has further refracted and is focused on the right place. Okay, this is the normal process. But now we know that the cortical opacities is so much extensive that the refractive index of this cortex is now equal to the refractive index of the nucleus. And what will happen? This second refraction will not occur because of the single refractive medium. This double refraction will now become a single refraction. Okay, so there will be only a single refraction. When a light rays come, it will be bent like this and it will be focused. It should be focused. The light ray should supposed to focus right over here. Now it is focusing behind the retina. Okay, this is called hypermetropic shift, as hypermetropia has been developed. Okay, so this is called hyper image has now been formed behind the retina. This is called hypermetropic shift, which is occurring in immature cataract stage due to the coalescing of these spokes like cortical opacities. Now, the fourth stage we have the intumescent stage. Intumescent stage is occurring in some individual and which due to extreme hydration, okay, as the permeability has changed and now there is the continuous hydration of the lens. What will happen? Due to this hydration, the lens will become enlarged and it will block the pupil. Okay, it will block the pupil and has now caused the glaucoma. Okay, as the fluid will collect right over here in this posterior chamber and ultimately it will cause the iris bombay and because of the fluid collection and angle closure glaucoma. Okay, so it is causing it will be discussed in details in the upcoming lecture, but this is the complication. Okay, now it has caused angle closure glaucoma. This is occurring in some individual in intumescent stage. Okay, now we have the final stage, the mature cataraceous stage. In mature cataraceous stage, now the opacity will extend to the nucleus. Okay, these opacities were basically the cortical. Okay, the cortical. Now these opacities will extend to the nucleus and the entire lens will opacify. Okay, now the entire lens will opacify. This is called mature cataraceous stage. So this is the final stage. So these are the stages in cortical cataract and its pathogenesis. Now we have the last senile cataract, which is nuclear cataract. In the nuclear cataract, what is happening? The pathogenesis is entirely opposite to cortical cataract. In the nuclear cataract, there is the compactness. Okay, and the nuclear cataract, what will happen? It is opposite. The compactness and the hardness will be so much increased in the nucleus that it will sclerosed. It is because of the dehydration. As in the cortical cataract, there was hydration, there was extensive hydration. But now in the nuclear cataract, opposite occurs. There is the dehydration, and due to the dehydration, the entire nucleus becomes so hard and sclerosed. Okay, that a phenomena is occurring which is called myopic shift, opposite to the hypermetropic shift. Why? Think about it. Now when a light rays come, this light ray has come and it has been deviated. Okay, refracted. Now this nucleus has so much sclerosed that its refractive index will increase so much that it will cause extensive refraction and will focus the light in front of the retina. So we know that in myopia the light is focused on the in front of the retina. So now the light has been focused in front of the retina. Okay, the light is so much refracting because of the sclerosed nucleus that the light these are focused in the front of the retina. This is called myopic shift, which is exactly opposite to a hypermetropic shift in the immature stage. Okay, and this sclerosed nucleus ultimately will involve these opacities and this hardness will extend to the entire lens and the entire lens will become hard and sclerosed. Okay, so this is the fate of nuclear cataract. Now the clinical features can be taken out from these pathogenesis. As we noted, in the posterior subcapsular cataract, there is the visual worsening at day. So we will have visual deterioration. As in the liminal stage, we will perceive extensive brightness called glare. So we will perceive glare. As in incipient stage, there is the different indexes and now there is the multiple image, double image, multiple images and the halos. Okay, and in the immature cataract stage, we have the the hypermetropia, and in the intumescent stage we have the pacomorphic glaucoma, and in the nuclear cataract stage we have the myopia. Now diagnosis and treatment. The best diagnosis is made, as I told you before, in congenital cataract is the slit lamp examination, and the treatment is again the removal of this cataracceous lens. Okay, it is the only satisfactory treatment is the surgical removal of the lens through a common procedure which is called nowadays, which is applied extracapsular cataract extraction. This procedure will be discussed in another lecture in detail as it needs explanation. Okay, so this was about acquired cataract. I also have prepared notes. I will give you the link in the description. You can go through the notes and can learn more. Thanks for watching the video.